And welcome back to my channel. My name is Rebecca. Remember to like, subscribe and share. So today I'm going to be sharing with you my role as a nurse specialist working in an NHS hospital in the UK. So basically I previously shared with you how I moved from Ghana to the UK 17 years ago and registered as a nurse, and I worked on the ward for 5 years before becoming a nurse specialist in a specialist area for sickle cell. Now I've been doing that for about 11 years, although I had a break of 18 months because I needed a change. So I went to become a specialist nurse for epilepsy for 18 months before coming back to be the lead nurse for sickle cell and thalassaemia service. So what is sickle cell? So sickle cell is genetically inherited blood disorder, which means that you need to inherit the sickle cell gene from both mom and dad to have sickle cell disease. There are some people who inherit the normal hemoglobin, which is hemoglobin A, from one parent, and then the sickle hemoglobin from the other parent. And these people are carriers. They are usually healthy, but they can pass on the sickle gene to their children. For people who have the sickle cell disease, the main problems they have, one is anemia. Anemia is because their red blood cells are breaking down very quickly. Therefore, it leads to anemia, and it's not because they are iron deficient. Another problem they have is what we refer to as sickle cell crisis. The crisis is the painful episodes that they have whereby their red blood cell, because it's a sickle shape, like half moon shape, they actually lead to blockage in small blood vessels, and these blockage would prevent oxygen to go into those parts of the body. And if oxygen is not going to certain part of your body, the result is pain. So that is what causes the sickle cell crisis or the pain, which is severe and can lead to a lot of complications. Now, what do I do? So the UK NHS does have two major screening programs. They have the newborn screening program and antenatal screening program. They believe in prevention and early intervention. So with pregnant women, every pregnant woman who goes to see a midwife, they would go through what we call family origin questionnaire, and areas where they refer to as high prevalence area, all women would be offered sickle cell and thalassemia screening. Areas that are not high prevalence areas, they look through the family origin questionnaire and then they would offer them screening. Sickle cell affects people most often from Africa, the Caribbean, Middle East, Mediterranean, India, and the warm countries as well. Not only Black people have sickle cell disease. Therefore, screening is offered to the women, and we offer screening to their fathers of the babies to see whether there is any risk of them having a child with sickle cell disease, and we offer them advice, counseling, and any intervention they may want. We also offer screening and advice to newly born babies who are found to be carriers as well, or newly born babies who are found to have sickle cell disease. We go to the parents' home, we give them information and advise them as to how to look after this child when they're growing and the next stage of their care. Also, women going through assisted conception or fertility are offered sickle cell screening in the hospital I work at. And then if anyone is found to be a carrier, we will see them in clinic, provide counseling, information, and screening to the father to be of the baby to see whether there is a risk there again. We also offer general advice for young couple who are planning to marry and they want to know their status, and anyone who has gone to have a test in the hospital within the locality and found to be a carrier for sickle cell. We offer genetic counseling, we offer family screening, just to make sure that people are aware of the implications. We do education, we do health promotion, and a lot more, and supporting people who have sickle cell disease in the area. So these are the main things that my team does or I do. I've got a lot more to say about sickle, but at the moment I'll leave it here, and like, subscribe and share. Take care, and I'll see you next Sunday.